Hi YouTube family and friends, how are you guys doing? I hope you guys are doing well. My name is Faven and thank you for coming to my channel. Today I want to talk about briefly on what's going on with me, and maybe on other videos I can go in detail about them. So I'm trying to find a diagnosis. I don't have a diagnosis yet, so maybe you guys can help me. Maybe somebody has these symptoms or similar symptoms, and yeah. But anyways, like I said, my name is Faven. Thank you very much for coming to my channel. Make sure you guys like, subscribe, share, comment, all that jazz that YouTubers say. Make sure you do, please. Anyway, so all these symptoms start May 28th. Today is August 3rd. And I have been going through this since then. So that's what, May 28th to June 28th, that's a month. July 28th, that's 2 months. 29, 30, 31, 1, 2, 3. That's 2 months and 6 days. So that's 30, 30, 60, 66 days. Well, almost 67 days since this has been going on. It might not be a long period of time, but I haven't been to work since June 26th. June 26th was my last day. So June 27th to July 27th, that's a month. 28, 29, 30, 31, 1, 2, 3. That's 33, 6, 30, 37 days. I haven't been to work in 37 days. I said 36 and a half days. I worked one day for 4 hours and I was miserable. So these symptoms started with me being extremely dizzy. May 28th, the dizziness started. I've never, ever been that dizzy my entire life. I felt like I was going to pass out while I was driving. I got extremely dizzy. I got blurry vision. I got extremely hot, and I got extremely nauseous. I got home safely, thank God. Told my husband about it. He said, maybe you're just tired and dehydrated. I agreed. I went to bed the next day, went to work, still felt dizzy. Not that nauseous, but just I was feeling dizzy. So I got some Gatorade for lunch, and I don't remember what I ate, but I made sure I had Gatorade, and I made sure I was drinking water to hydrate myself, and taking it easy as much as I can at work. The weekend I was off, I rested. I thought maybe after the weekend I'll feel better. No, your girl is still dizzy. I went on for a few more days, and I talked to one of the providers I work with, and we both agreed on vertigo. Because I work at urgent care, we see patients with vertigo. The symptoms felt like it was very similar to that. So we decided to start on Maclizine, which helps for vertigo. I'm extremely sensitive to medication, so when she gave me Maclizine, I was knocked out for like 12 hours. I was gone. I was done. I can't take medicine like that and work. She said, why don't you just cut it in half? I said, even if it doesn't put me to sleep, I'm going to be groggy, and I can't do that while driving and working. That's not going to work for me. So she's like, I agree. She's like, don't worry about Maclizine. See your primary care doctor. I agreed with her. I made an appointment for like 2.5 weeks later, thinking maybe within that time it will go away, and if it goes away I can just cancel the appointment or just have an appointment, like a follow-up with her anyway. No, it did not go away, and I went to the emergency room because I had to take my husband to the hospital anyways. He needed to be seen in the emergency room. I went and I got seen myself. They gave me patches to put behind my ear for vertigo, or well, they said it was benign vertigo, meaning like my vertigo it was not considered to be vertigo, but they still wanted to treat it as being vertigo. So I told them I can't take Maclizine. They said, well, we're going to prescribe you Maclizine. I said, I even have it in my bag. I can't take this. This is way too strong. Even if I take a half, I'm going to still be groggy, sleepy. I can't do that, and I can't be sleepy, groggy, and be dizzy driving and working. That's not going to. Who wants to feel those? Even being at home, who wants to feel that? Things to do. So he agreed. So they gave me to put patches behind my ear. The patch lasts 3 days at a time, and either it falls off on its own or you got to change it. I used 3, 6, I used like 3 of them. I used, yeah, one full prescription, one full thing they gave me 3 that lasts for 12 days. I used all 3. Well, I was using the third one as when I had my appointment with my primary care doctor. I said, I have the patch behind my ear, but it's not helping. I'm still dizzy. It's not doing anything. It's actually hurting behind my ear. So I would switch one patch. I'll have one ear, and then 3 days I'll switch the other ear, giving this side a rest, and then I'll switch back and forth. I told her it's not helping at all. She said, okay. And when between I got the patch and between my doctor's appointment, other symptoms started happening. And those symptoms were feeling like I was stuck in my own body. I wasn't able to move, speak, just think correctly. I wasn't able to talk correctly. My speech would be extremely slurred. My body would be extremely tired and fatigued. My mind felt like I was in complete fog. I wasn't able to see correctly. I felt like I was getting blurry vision. And if I was sitting like this, I would be stuck like this for like 5 minutes without having able to move my hand. I was completely spaced out. That happened maybe like 4 to 5 times in the evening. My husband was really worried. He's like, there's something definitely going on with you. Like, you really need to see your doctor. So I went to my doctor's appointment. I told her about it. We did a couple of blood draws, a couple of orthostatics. We did EKG. Orthostatic was positive, which I already knew because I was being dizzy. Orthostatics is checking your blood pressure and your pulse 3 different times, meaning from laying, standing, and standing. It'll see if there's any difference. It was positive, which I already knew because I have my own machine at home, which is this. I have a blood pressure kit at home, so I check it myself also, and it was positive. I knew that. She did EKG, which was no changes in EKG, thank God. I had EKG done in February, so there was no changes. She ordered an EEG, which is to check your brain wave. I will do another video explaining what EEG, MRI, and CT is on the next video. And she also ordered EEG, and she gave me a referral for ENT. She gave me a referral. Well, I already have a referral, but she gave me another one for neurology, and she said to follow up in a month. So I made those appointments. Those appointments were not until like beginning of June. July? Yeah, beginning of July. The EEG and ENT was in July. So between the 15th and between the 15th and the 26th, the symptoms kept on going. Same symptoms, nothing has changed. Actually got worse. On the 26th was the last day I worked of June. It was a Friday. I almost passed out at work. I had already told one of the nurse practitioners to check on me throughout the day because I gave her all the symptoms I just mentioned. And so the slurry speech, the fogginess, the dizziness, and the feel like stuck in the same position started again towards the evening. And she said I had to go to the emergency room, which I agreed with her. I drove myself because it was like 10 minutes away. I drove myself. I told my husband to meet me there. When they got there, of course, they do your background, whatever. They do all that stuff. They did blood draws. They wanted to wait for the blood draw. And if they said if the blood draw was fine, then they're going to do an MRI, CT. So they did CT. I think they did CT of my neck as well. And they said your CT is fine. I do have scarring on the left side of my brain because of excessive migraines. Besides that, they said CT was completely normal, which I agreed. Well, I didn't agree, but I just said I'm happy it's normal because at least there's no stroke or whatever. That's what they thought it was. But the other symptoms that start happening is feeling overwhelming weakness throughout the body, and still feeling very dizzy, very, very dizzy. My speech was very slurred. They couldn't understand why. They asked my husband, has this ever happened besides now, like past a few weeks? He said no. We've been together for 14 years. He said no. So they admitted me in for overnight observation. In the morning they did MRI, which came back normal, thank God. But I was still having slurry speech, and the weakness in my body got even worse. I couldn't sit up on my own. I couldn't sit up on the bed on my own. I could not get off the bed on my own. I couldn't stand up on my own, and I could not walk on my own. It felt like I had brand new legs. My arms were extremely weak. Eating breakfast was hard. Like getting a fork, holding a fork, like even like holding my hand up like this, my arm feels very heavy, and it feels like I need to put my arm down because it feels heavy and it feels tired. So in order at that time, my weakness was like 10 times worse. In order to like pick up a fork and eat was difficult. The way I was holding my hands was different. Like the way I was holding my fork was different. So it took me quite a while to finish my breakfast. And after I ate, they came back to like, we're going to do your physical testing again to see maybe you probably were just really hungry or not hydrated enough, whatever. I'm like, whatever, I'll do whatever you tell me to do. So they did the neurologist came and she did an extensive test. She checked my eyes, my ears, my mouth, my arms, my legs, my stomach, my back. She had me sit up, stand up. Like it was difficult. It was very difficult. I told her, I said, I am beyond tired. Like I can feel like I can sleep for like 10 hours. I couldn't sit up on my own, so she had to help me stand up. The minute I stood up is the minute I fell back down. She's like, I need to see you walk. So my husband, at that time, my husband came. So he's like, he had to help me sit up. He had to help me stand up. He had to help me walk. He's like, you can't walk on your own. I said, it seems like I can't walk on my own right now. And she said, has that ever happened to you? I said, no. I've never broken an arm. I've never broken my leg. At that time, I had no pain anywhere in my body. I had no pain at all. It's just the like unknown weakness of my whole entire body. And she said, it's unusual for me to have that. And so she said she's going to talk to the doctors that seen me, and they agreed I need to have a walker and for me to follow up with the neurologist. Thankfully, I had an appointment that Tuesday. So I had to call off, of course. I had to call off Saturday, Sunday, and Tuesday because anyways, I went to see the neurologist. She couldn't figure out what was going on herself. She's like, maybe you need to strengthen your muscles. I'm going to send you to PM&R. I went to PM&R the next day. Thankfully, the appointments I was getting were like back to back, back to back. I was so grateful and thankful for that because usually it takes months to get in. He was unable to help me, and I was really sad about it. And he can see that I was talking very, very slow. I wasn't able to sit up on the bed on my own. My husband had to help me. I couldn't get up on my own. My husband had to help me. He's like, he couldn't do the physical activity, like the physical examination, because he could clearly see there is something seriously wrong, but he does not have a diagnosis. So what he said is, in order to have a diagnosis, then you can have a prognosis. Well, if you have a diagnosis, then you know how to treat it, and you'd be able to say, okay, if it's MS, then we can do XYZ. If it's this, then we can do XYZ. Or if it's just something, whatever the diagnosis, then there is going to be a treatment plan. But there's no diagnosis, so there's no treatment plan. And he said he can't see me if there's no diagnosis. But he did take me off for 1 full week because I had a bunch of testing. The next day I had an EEG. That was the 7th, I think. I reacted negatively. That's what they said. It was reacted negatively, but my head wouldn't stop shaking like that. It would not stop. I was not doing it. My body just took over. It did it itself. I started getting very slurry speech again. I got really extremely foggy, and I got confused. When I left EEG, I didn't get the results right away. It took me like 3-4 days to come back. I had an ENT appointment, and I had a primary care appointment the following day. So I went to see, I did my ENT first. So they did an extensive ear check, and this ENT. no, I saw my primary care first. My primary care, she did more testing, more blood work. She checked my thyroid, it was normal, she said. And she's like, she doesn't know. Like, I gave her my FMLA forms. I had 2 copies, one for her and one for my neurologist. If in the case the neurologist does not fill it out, she could fill it out. So I gave her a copy. I said, don't fill it out yet. I'm going to have an appointment with my neurologist on Thursday. In case if she doesn't do it, then you will. I seen my neurologist, my primary care first, and then I seen the EEG. After I left the EEG, I start stuttering really bad. I started for 72 hours. I've never stuttered before. I started for 72 hours straight. And I still was having excessive muscle weakness, and I couldn't walk on my own. I had to have the walker. And then the following day, I'm so tired of these appointments. The following day, I had another appointment with the neurologist. And she said, you know what, you can't go back to work. I'm going to take you off for 2 more weeks. So that's equal like 3.5 weeks I was off. So she's like, you have to go back to work on the 24th. I'm like, fine. That gives me enough time to at least have 2 to 3 sessions of physical therapy, which they ordered for me. And they also ordered rehab psychology appointment. Maybe it's something that is psychological that has to deal with rehab. So I had my first appointment with her. I had 2 physical therapy appointments. My physical therapist says I'm not nowhere near where I need to be. As for a person my age group, my walk is significantly low compared to what the normal walk is for my age group. She said that there's no way you can work right now. There's just no way you could do your regular activities. After physical therapy, I am burnt out for the rest of the day. I will force myself, if I have things to do, I will force myself to go ahead and do them before I get home. Once I get home, it's done, it's a wrap. But I didn't start having pain until then. Now I have pain constantly throughout the day. It's not just one specific spot, it's the whole entire body. It starts from the base of my neck all the way to my ankle. And it's my arms, my legs, my thighs, the back of my calves, especially over here. It hurts. Sometimes it feels like my chest is hurting. Not chest pain, but like muscle thing. But I do keep bare aspirin and regular aspirin here at home. I have Tylenol. I'm not supposed to take Motrin because I had bariatric surgery, but if I'm to the point where I'm that in pain, I will take at least like 400 milligrams worth. I have Benadryl when I get really in pain or whatever. I'll take Benadryl so I can go to sleep. The pain, sometimes I can't sleep. It's painful. I can't. It's really hard. I can't do something for a long period of time. I can walk on my own. If I'm not at home, I will use my walker, but I can't walk consistently no more than 20 minutes, like 15 to 20 minutes. After that, I am extremely fatigued. My legs and my body start dragging. My right arm starts shaking. Like when I'm holding this, my arm will be like shaking like that, like someone has Parkinson's. I asked her to see if I can be tested for MS, but she said she doesn't believe it's MS. So now I'm doing my own research, and the one thing I came across is the abbreviation's MG, which is myasthenia gravis. And the crazy thing is, yesterday I was looking to see what my blood type was, and I thought I had saved it in my email. I have a card, I just can't find it. I thought I saved it in my email, so I was looking for it, and I came across my school paper that had to do with myasthenia gravis, and I was reading it, and I'm like, these symptoms look quite similar to mine. And so I did a little bit more research, and the symptoms are just uncanny. Like they are really they're really similar to mine. Not all of them. Sometimes it's called the snowflake disease, I think someone was saying, because not everyone has the same thing. Like MS is usually generally a lot of people have the same thing, but MG or myasthenia gravis is considered to be a snowflake disease because every snowflake is different. So every single person's myasthenia gravis is not going to be the same. But so some symptoms can be considered to be mild, subtle, or life-threatening, but it consists with muscle weakness, yes, worsening in muscle use, meaning like if you constantly do something, then you have muscle weakness and pain and fatigue, more muscle pain during the evening, which is, oh my god, to the point that's when I'm like, that is exactly me. In the evening, I am in pain. Like my whole, like I'm in pain to the point where I want to cry in pain. Symptoms can also be like sometimes I might get a little bit blurry vision. My eyelids could be droopy. I don't know if my eyelids feels droopy or not, but I know I'm not in my, it's not normal for me to be, usually my eyes are just a little bit more bigger. Eyelid muscle weakness, facial muscle weakness when I get really tired and feeling that state of feeling, I feel like my muscles in my face is just a little bit not excessive, but a little bit trouble swallowing. Sometimes my throat feels not sore, but it just feels weird. My throat feels weird. Fatigue in jaw. Those were the first symptoms I had, was fatigue in jaw and neck. After I had my Botox injection on May 21st, that's the first two things I experienced, was fatigue in jaw and neck. The jaw, I still feel a little bit fatigued, but my neck, I mean, it still hurts, but it's not as bad. But the fatigue in jaw, I still experience it, but it wasn't as bad as it did for the first like 3 weeks. And slurry speech. When I get overworked, I do get slurry speech. So those are some of the things. And then they said for examination, repeat blinking. So they'll have you constantly repeat your blinking, and like, you know, constantly, like, I don't want to do it now because just in case, I don't want to activate anything on my body. So someone that you have them constantly repeat blinking their eyes to see if there's any changes, moving their eyes up and down if there's any changes, which when I go to physical therapy, we do that one, and she knows that once I move my eye in a certain direction, my gait change, my walk changes, and I get extremely dizzy, and I have to stop immediately what I'm doing, or else I feel like I'm gonna fall, and it's just crazy. Movement of your arms and legs, I don't want to do that right now because I have some things to do, and if I show you what that means, I will be hurting myself. Basically, it's having somebody moving their arms up and down from like the shoulder up and down, and to see if there's any excessive weakness. 1000% positive on that. Same thing with my legs. After physical therapy, of 45 minutes of physical therapy, I am exhausted. I start walking very slow, very, very slow, and my muscles start to hurt pretty bad. And then checking for thymoma, meaning like a tumor in your thyroid. They said that my thyroid was fine, thankfully, but on some cases of people that have MG or myasthenia gravis, their thyroid would not be affected as well. That's why they call it a snowflake disease, is because everybody does not have the same symptoms, and some people don't have the thyroid problem. So sometimes either they will take it out or leave it. There are some antibodies that gets affected, your ACH receptors, your MuSK antibodies, your what is it called? I need to rewrite these. I was watching it on YouTube and writing them up. You to do CT and MRI of your thyroid gland. I'm going to see if they did the thyroid gland or not. I'm not sure. And there's some things that you can take through either IV or medication to see if you truly do have MG. And I'm going to rewrite this because the way I wrote it just does not look right, but some of the treatments are some medications you can take, some IV medications, also tablet medications, also something called plasma whatever, like they take your plasma and clean it up and take the bad antibiotics and add some more antibiotics and some more nutrients in them, and then put it back in your body. Some, like I said, thymoectomy, which is the removal of the thyroid gland. Steroids, which I hate steroids. But yeah, so it could be, like I said, mild, severe, and moderate, and the severe is called myasthenia crisis, which I hope to pray to God I will never have that. That could be so severe where it could be life-threatening. It will affect your respiratory muscles to where you're unable to breathe on your own. So either you have to be on a non-invasive ventilation, like a bypass kind of thing, or you have to be intubated. Those are the crisis. So I'm going to do more research on this and do my own research. I'm going to reread my PowerPoint and my research paper I wrote on this, and actually like really go in depth of research on this to see maybe it is because some of these things are just like pinpointing me very, very well, and at the same time it's like there's certain things that you got to take or do in order to get the positive testing for it. So I already sent my doctor a message to see if she can get tested for these, and before I go, I'm gonna have a complete full written report on it and give it to her. Like, either you look it up yourself, or you could read this yourself and talk with other providers and see what it is testing. As long as you put the testing in, I will do it. Yeah, but anyways, that's all I have for today, and hopefully I can get a result. But if anybody has any of these symptoms, like I was saying, excessive fatigue, muscle weakness, feeling foggy, speech problems, out of nowhere, literally it felt like out of nowhere, like if your muscles are getting to the point where they're very exhaustive with just doing manual, like not manual work, but like minimal work. Yesterday I was mixing a cake, and I was extremely fatigued. My arms hurt. If your muscles and your body feels like it's in excessive pain throughout at nighttime, like you get more fatigue and in pain more at night than you do during the day, can you please leave in the comment below? Maybe we can help each other out. And I really want to find a diagnosis. I feel like once I find a diagnosis, I'll be able to know how to treat it. But right now it's like throwing a dart in the dark. Like, I don't know what's going on. I was thinking maybe Lyme's disease, but I'm really not really concerned for Lyme disease. One, I don't have that bullseye rash that they're talking about. I don't live near a forest area. I've not been around any animals or anything like that. But the symptoms of just Lyme's disease, I don't consider Lyme disease. I will do my research on it, but if anybody has any other experiences that like similar to this, can you please leave it down below? Maybe we can both help each other out. And yeah, anyways, thank you for watching. And if you see me with another video with the same shirt, because it's the same day, right now I'm feeling okay because I've not done anything yet, so I want to put up a couple of more videos before it starts up. But anyways, thank you for watching, and hopefully I will get some answers and I will update you guys. And yeah, love you all. Make sure you like, subscribe, share, and comment. Have a good day. Bye.